Welcome back to our channel, Marriage and Medicine. So this week we are going to be talking about residency. So if you're not sure what residency is basically your step that you go through after medical school. And residency is just more training that's geared towards your specialty. So if you pick emergency medicine or surgery or pediatrics, whatever you decide to be a doctor in is what your residency is going to be training you for. So residency also will vary depending on what you pick. So it can range anywhere from 3 to about 6 years-ish.
5 years.
Yeah, somewhere around there. So like emergency medicine is 3 years, but if you do a specialty like surgery, that's usually 5 years. So it just depends on what you choose. That will determine how long your residency is.
Ultimately, residency is kind of what you've been waiting for. As soon as you get into medical school, you basically can't wait to get to that next step, because medical school is it's just a lot of studying for the most part. Of course, when you get to third year, you get more kind of clinical exposure and those kind of things. But you really can't wait to get to the residency, because that's when you actually start to feel like a doctor. You start to actually be able to take care of patients. And for the first time, orders that you put into the computer will actually affect the patient. It's a scary time when you kind of put in that first order, but it's a great time altogether. So essentially during residency, you go through, when you initially start out, you're considered an intern. An intern is essentially your first year. You coming in brand new, you essentially don't know what you're doing. You go from a fourth year med student where you feel like you're on top of the world, you're like, yeah, I'm the big dog on campus, to an intern and you're like, I don't even know how to put an order in. So can somebody tell me how to do that, please? Things like that happen all the time. So, I mean, it's definitely a great transition altogether. But in your intern year, depending, of course, what you go into, it's probably going to be the most stressful and the most busy time. As an intern, your job on a lot of teams, for example, if you're doing like critical care or if you're doing like kind of floor rounds, you're going to be writing pretty much all of the notes. You're going to be seeing all the patients initially before the upper levels. Your job is to basically manage the patients. The patient is your responsibility, essentially. The upper levels a lot of times will oversee you, but it's your responsibility to make sure that your patients are getting taken care of appropriately. So for me in particular, again, I did emergency medicine. So in emergency medicine as an intern, you really get a chance to see a little bit of everything. Again, emergency medicine, you see everything, so you have to be able to take care of everything. So you kind of rotate through many different fields. For example, you go through obstetrics and gynecology, where you're delivering babies on a daily basis. You go through trauma, where you're actually going and seeing just traumatic injuries like car accidents, gunshot wounds, all those kind of things that you're managing. You have many shifts in the emergency department still. So like half of your year, a lot of times is spent actually in the emergency department learning how to be an emergency medicine doctor. And the other half is essentially learning how to do everything else within those specialties. So you're doing time in the medicine ICU a lot of times during your intern year. You're also learning how to intubate, doing anesthesia rotation. So you kind of pretty much bounce from one rotation to another. And it gets difficult mainly because as an intern, again, you don't exactly know what to expect. You don't exactly know what your role is a lot of times on these different teams until you kind of get going. So the first week of a lot of these rotations is really just a filling out process, trying to learn how the team operates, how that team likes to function, essentially. So that's pretty much what you do during intern year. A lot of intern year is just learning new things altogether, learning how to put in orders, learning how to appropriately manage patients, and what each person likes in particular. Each team that you're working with, what they like in particular for you to do in order to be the most vital person for the team. And just remember that being an intern does not last forever. Once you get to that second and third year or higher up, things get better. You get a little bit more responsibility where you're expected to know more, you're expected to know how to do more things, be better at procedures, all those kind of things. But you won't be having to deal with all that gut work that you have to do as an intern. All the note writing, again, you're still probably going to have to write notes. I mean, as emergency, you're clearly going to have to write notes for patients that you see. But when you're in those like team-based rotations, where you have intern, upper level, those kind of things, a lot of times the upper level is doing more kind of overseeing, just making sure that all the people that the intern is seeing is doing well, making sure that everybody's not missing any orders, making sure they know what they're doing, all those kind of things. So it's a lot more, I wouldn't say laid back, but it's more work that you will enjoy doing versus having to just do in notes and those kind of things. And then of course, once you get to your last year residency, it's just an exciting time because you're making that transition to the point where you're going to be on your own. You're going to get to that point where you're practicing on your own. So throughout your last year residency, make sure that you take the time to hone up any kind of skills that you feel like you're missing during that time. Talk to individuals about what they wish they would have done in their last year to get them prepared for being an attending. So definitely take advantage of that last year, and understand that at that time you're a leader. You're going to be doing a lot of teaching. You're going to be teaching a lot of the interns that are coming in under you how to be a doctor. And so it's a lot of responsibility from that standpoint. But it is absolutely the best year of residency because you see that money's coming, but you also actually feel much more confident in your skills and abilities, and so you get more comfortable in your skill set. Along with becoming a resident altogether, this is the first time that you're actually getting a paycheck. So it's definitely great that you definitely
Small
start to
paycheck.
hey, a paycheck nonetheless. You know, it's enough to live on. You're not gonna.
Barely.
Some people do. Some people go out and they still.
You said it's enough to live on. I'm like, barely.
It's enough to live on. Especially if you have a dual income household.
Yeah,
you're
if
fine.
you both work, you're
fine.
good.
If
But
it's just one.
if you both work and if you aren't like thinking I have 2 paychecks, let's go spend it like crazy, I'll say that.
Right.
Some people get to residency and they just lose their minds and like buy a house, buy a car, buy another car, do all this crazy. So
yeah.
if you're like reasonable with it, you should be
Should
fine.
be fine. Yeah. It's definitely enough. I mean, you're making still more than the average person in America for the most part. So the average individual, not household.
Oh my
The average individual.
Okay.
So you still, as a single person, for sure, you should be able to manage. Your
Yeah,
money.
single people
Shouldn't be an
and
issue.
dual income people should be fine.
Yeah.
But if you are a 1 income household, it can be done.
Yeah.
But you have to be very intentional about how you get it done. Like you have to budget, you have to be on the same page because otherwise it can be really stressful and can cause some friction, I guess you would say,
And you want to
in a relationship. And so you definitely both have to come together and be on the same page. That's something we have to do every month with me not working. We have to every month sit down. I mean, we did this even before residency, but every month you have to sit down and kind of look over what all your finances are for the month, look at your check, and just budget everything out. Because if you're just not doing that, I don't feel like you're going to be as successful at all. If you're just kind of paying stuff, but not seeing where it's actually going.
Exactly. And then on top of that, the only kind of caveat would be if you're in a high cost of living area, like you're doing residency in New York or something of that nature, you don't really get paid much more, unfortunately, depending on where you live. But that's kind of the only time where you could definitely run into a little bit more issues being able to live on your own from that standpoint. Outside of managing your finances, the next thing that you have to worry about is, of course, your time is going to be very limited. Your time to enjoy spending time with family, your time to just relax and kind of do the things that you want to do on a normal basis. A lot of times it's going to be limited, especially if you go into kind of more rigorous fields such as like surgery or if you're doing a lot of like internal medicine where you're doing a lot of inpatient things or OB, different things like that, where your time is, you're in the hospital a lot. So it's definitely important that if you're in one of those fields, you make sure you manage your time appropriately. Even in emergency medicine, you're going to be working hard. But the good thing about emergency medicine is shift work. You're going to work anywhere between 9 to 12 hours a lot of times, and you'll get to go home and you have the rest of the day to do whatever you need to do. And also emergency, you get more time off, more days off than any other specialty, it seems like. So emergency is the way to go. Yeah. From that standpoint. So it varies, again, based off of whatever program that you're in altogether.
Yeah, I would say for when he actually works emergency medicine shifts, those shifts I enjoy a lot more than when he did shifts like in the ICU or in OB-GYN or wherever, because I feel like in emergency, you kind of can expect, or you kind of get used to like what that is like. But when you go to other rotations, especially the longer ones that have longer hours,
14
it's
hour
just kind of
ICU
like you
shifts.
can never really adjust because you don't ever really know what's going to happen. Like it could be a 12-hour shift, or it could end up running longer and being a 14-hour shift. So it's just like, it's always like you feel like it's unexpected of what's going to happen for that day. So I feel like with emergency, you kind of get a little bit more of like stability as far as being prepared to know what to expect. And you don't, I feel like overall we kind of still get a good amount of like work-life balance where I don't feel like he's gone a whole lot of the time and I never ever get to see him.
And then the last thing that I was kind of wanting to make sure I talked about was studying. So every year as a resident, you have to take what they call an in-service exam. So every residency, every specialty has their own particular in-service exam that they're going to take. It's a national test essentially that everybody's taking to compare you to see how you're doing compared to your peers. And so while you think that all of your test taking and studying and all that stuff is over after med school, it's not quite the case. Now you have to study while also working. So that's fun times on a limited amount of time trying to get your studying in. But please understand that you will get most of your learning will be done while you're actually on shift. You're going to learn the majority kind of bread and butter things that is tested a lot on exams. You're going to learn the majority of those kind of things. So make sure you do also spend time outside of that, getting a couple questions in a day from every kind of specialty has their own little question bank that they go to. So make sure that you're spending time getting through just a couple of questions a day in order to make sure that you're still keeping up with the actual test taking skills that'll make you do well on the in-service exam altogether. Do you have anything else from a spousal standpoint?
I mean, I guess the only thing I can say with going into residency as a significant other is, I don't know, just to, I guess, prepare for unexpected things to happen. It's the best way to word it, because he doesn't always get off when his shift is supposed to end, especially if he's in a different rotation altogether. But even in emergency, if he's working and he's supposed to get off at 3 o'clock, he doesn't always get off at 3 o'clock. Like sometimes it might be a little bit earlier, sometimes it could be later. And so people will like see their spouse's schedule and be like, oh, okay, you work till 3. I expect you'll probably be home by like 3:30. And with medicine, it's not really like that. So I would just say to kind of prepare for that. Like, don't expect that they might be home all the time at their scheduled time when they're supposed to get off. Because I feel like that kind of lets people down. Like, oh, they're going to get off at 6 when I'm going to have dinner ready, and then it's 7 o'clock and they're still not here. So just, you kind of have to like have your own schedule and your own things outside of them so that you're not just like sitting around feeling let down in a sense. So I would say definitely try to make sure you have your own schedule or routine of some sort, especially if you're not working, and just not to get your hopes up as far as like their schedule being exactly what it says it is, because it might change, it might be later, it might be earlier. So just prepare for that so that you're not let down when those times do happen.
Yeah. And one more thing is basically make sure that you are always taking advantage of your days off. You're going to want to sleep a lot of times. You just want to go to sleep. You want to rest. You don't want to have to take care of all the household items. And particularly if you're in one of the like surgery specialties and those kind of things, you usually get maybe one day off a week. And on that day, you're going to try to get through all of your kind of to-do list kind of things that you've been putting off for the entire week. And then you're just going to want to sleep. But make sure that you actually take advantage of that day. Make sure that you get outside, go see family, go talk to family, go do something. Because if not, your day off is not going to feel like a day off. You're going to feel like you just wasted a day. It sounds kind of counterintuitive. You feel like if you can get home and just sleep, you're going to feel great. But it's kind of reverse. You want to make sure that you get out and actually do something that makes it feel like a day off, makes it feel enjoyable. That's all we have for today. If you have any questions or comments, please feel free to leave it in the comment section.
And follow us on Instagram. That is at marriage, the letter N, medicine. I'll put it in the details of this video too.
But thank y'all for watching. See y'all later.